This is Dr. Mike Ryan answering the question, what is the best treatment for hemosiderin staining? Hemosiderin staining is the medical term that describes brown discoloration in the lower calf around the ankle. Usually it's on the inner ankle, occasionally on the outer ankle, and it's related to high pressure in the vein circulation. And what happens is the veins under pressure become leaky and blood leaks out into the tissues, and the blood breaks down, and when it breaks down, the hemoglobin inside the blood cell is broken down into something called hemosiderin. The hemosiderin is viewed as by the local tissue as a foreign particle, and the cells in the tissue will then actually ingest it. They bring it into the cell and sequester it, thinking that it's something foreign. And the result is that small brown particle is now residing inside a cell, and those cells don't die. Those cells live as long as you live. Those are called the macrophages. And so what you end up having is a more or less permanent stain in the ankle area. This is the exact same process that happens when you actually have a tattoo. The same biology, the same sequence of events. And of course, tattoos, they do fade slowly with time, but they're more or less permanent. So hemosiderin staining is something that can improve. I have seen several patients actually have resolution of hemosiderin staining, but it's something that I don't promise people ahead of time to expect that that's going to be the case. More realistic is when they have hemosiderin staining and they have a vein treatment, the staining will lighten up. So it will change from being a dark brown to a light brown. As I said, occasionally I've seen a few patients that have resolution, but that's not very common. And when the pattern that I've seen also is those patients that have had improvement, it's taken 2 years. Typically, after treatment, within 1 to 2 months, it will lighten up. The other type of hemosiderin staining is what is associated with previous vein treatments or sclerotherapy, where you have a brown streak. That kind of hemosiderin staining, in my experience, can improve. It can take several months to even a few years. And the most important principle is often that's associated with untreated abnormal veins directly in that area adjacent to the area of staining. So in my practice, we will always look with an ultrasound machine and also a special transilluminating light to see if there are any feeder veins going into that area of discoloration. If there are, then we treat them, and that often will improve. But like I said, the improvement is very slow, over months to even a year or two. People do want to know, can I get it treated? And as I mentioned, it can be improved, but not necessarily resolved. And the timeline is very long. The best approach is really to prevent it from happening by a timely treatment. Unfortunately for people, that staining, when it creeps up, sometimes it creeps up very quickly. So if you have a vein condition, you're holding back on a treatment, if you keep an eye on what's going on around the inner ankle, if you begin to notice an area of red discoloration, that's how it starts, a little small red patch, that is your sign that the staining process is now in is undergoing its full process. So when that happens, it's really time to get a treatment if you want to avoid staining, because once it gets revved up, it's very difficult to make it completely go away. So Mike Ryan answering the question, can hemosiderin staining be treated?